Hi, I'm Angelo Salvucci. I'm the former EMS medical director and now assistant to Dr. Shepard. And today I wanted to introduce Dr. Sumit Chugh from Cedars-Sinai in our ongoing joint PRESTO research project. Many of you remember this all started back in 2008 when we joined CARES, the Cardiac Arrest Registry to Enhance Survival. We were the first community west of the Mississippi River to join this now nationwide project with the intent to take a careful look at all cardiac arrests and see what communities can do to improve their survival. We went from initially being about average, being about the same as other communities, to using all of this information, creating our CAM program, which you now all use, and as a result, being one of the very highest survival rate communities in the entire country. About 7 years ago, we were approached by Dr. Chugh with the concept of the PRESTO research project. PRESTO stands for the Prediction of Sudden Death in Multi-Ethnic Communities. The intent of this is to be able to determine with greater accuracy who is going to have a cardiac arrest. And with that information, you can implant a cardiac defibrillator or treat certain patients to prevent their cardiac arrest from occurring in the first place. We've done this in other disciplines. For example, in traffic collisions with improved road design and vehicle design, we have dramatically decreased the likelihood you're going to have a severe injury or die in a car crash. Advances in fire science have dramatically decreased the likelihood that you're going to be involved in a structure fire. So wouldn't it be great if we could do that with cardiac arrest, where the likelihood of having a cardiac arrest is about the same as it was 20 or 30 years ago? That blood that you draw for PRESTO is used by the PRESTO team at Cedars in two ways. They sequence the DNA to look for a genetic risk for having a sudden cardiac arrest, and they look for specific proteins that are released around the time of the cardiac arrest. And with that information, they hope to be able to early identify the risk after a heart attack, for example, or to identify a genetic risk and implant a cardiac defibrillator. There have been some exciting results already, and there's already a tool that Dr. Chugh and his team have developed that is much more accurate in determining who is going to have a cardiac arrest and needs a cardiac defibrillator. And before I turn this over to Dr. Chugh, I wanted to point out and remind you all just how amazing and extraordinary the Ventura County EMS system is. Cardiac arrest resuscitation and the lives we save is just one example of what a fantastic job all of you are doing and how well you serve the community. And thank you all for that.
Thank you for this opportunity to present a PRESTO research update. As you know, we've been studying cardiac arrest in two communities, in Portland, Oregon, for over 20 years, and we're in our 7th year. Here's beautiful Ventura County. A big shout out to all of you in the audience. Without you, we cannot do this research. So a big thank you to all the EMS agencies, as well as Ventura County EMS and the healthcare agency. It's a team sport, and if anything is done, it's done together. And I'm thanking you on behalf of the PRESTO research team at the Center for Cardiac Arrest Prevention at Cedars-Sinai. And here are some of the exciting developments this past year. It took us 20 years to pull this off, but we have now published a clinical risk prediction tool for prediction of ventricular fibrillation. We started out in Oregon, compared cases of cardiac arrest presenting with VF to a control group, did a bunch of work where we looked at their lifetime clinical records, combined with their EMS data, with ECGs, echoes, etc., did some prediction modeling and came up with a score that we call VF risk. This was then taken to Ventura County, where based on the work done in the last 6+ years, we were able to actually show this works, is pretty effective. And so we have this novel algorithm that will hopefully help to find much better the people who are at high risk and could benefit from an implantable defibrillator before they present with cardiac arrest. Of course, don't worry, it won't put us out of business. There's a lot of work for all of you to do. We continue with refining this prediction, and we're getting into AI, because with terabytes of data, we can't do this the old way. So we're looking at images, we're looking at whole genome data, and we're also looking at blood markers. In this regard, there is one more really wonderful discovery we've made from the blood samples that you give us, where we analyze blood biomarkers and the DNA. We have discovered 8 novel proteins that I would say we could call troponins of cardiac arrest. This work is out being reviewed. Let's see how it goes. In addition, from the DNA samples we make from what you provide us, 3,300 have had whole genome sequencing, and now we're looking at the genome and how it connects to ventricular fibrillation. This wonderful, busy, colorful picture actually shows these 8 proteins in the end that are really important, and all these various pathways that eventually end up being associated with ventricular fibrillation. So some important reminders: please don't throw away your hard work. Use these purple top tubes that are provided by PRESTO to prevent samples from clotting. Please label all the samples with incident number and date of service. Chill them with cold packs en route, then placed in the PRESTO refrigerator at the stations. Let your supervisors know that the sample's in the fridge so they can bring it to Moore Park. Also, there are additional PRESTO supplies, always located at Moore Park Station. Ask for the PRESTO box in the front admin area. If you have any questions, please contact the PRESTO Research Lab. Give us a call at 310-423-7357, 310-423-7357. And last but not least, you should be very proud of the work that you do. Looking since February 2015 to the beginning of this year, among a little over 2,500 cases, initial rhythms were about a quarter ventricular fibrillation, ventricular tachycardia, and the rest were non-shockable. Bystander CPR rates in the community in Ventura, on average, were 54%. We've got some work to do here. However, response time is amazing, 6 minutes. And in a third of patients, it's under 4 minutes. Sustained ROSC, over 30%. Survival to hospital discharge, 13% on average. These numbers are as good. In fact, they're among the best in the nation. Again, thank you for what you do and how you help us with the PRESTO research study and to help us get to our collective goal. Take care, all of you.